Rescue 21, respond. 3326 Davis Lane, possible CBA.
Rescue 21, copy.
You're responding to a 45-year-old female with notable weakness to the right side and facial droop.
The second link in the stroke chain of survival is rapid EMS dispatch. This is also the second D in the 8 Ds of stroke care.
Strokes receive a high dispatch priority, and we try to get there as quickly as possible. Part of the reason to get to them quickly is in case there's a life-threatening problem, but another part is to get them to a stroke hospital where fibrinolytic treatment can be administered and possibly reverse the damage.
They're here.
Hi, Mrs. Vega. We're going to help you out. Eddie's going to take your vitals, and I'm going to ask a few questions.
Well, the first thing I want to do is rule out any other possible causes for the patient's condition. I discovered Mrs. Vega wasn't experiencing any chest or back pain, and she wasn't having any trouble breathing. Mr. Vega also informed us that she didn't have any history of diabetes or seizures. And to rule out hypoglycemia, we did a quick finger stick blood glucose analysis. It was fine. I also confirmed she's not on any blood thinners.
EMS should also test the neurologic condition of the patient with a stroke assessment, such as the Cincinnati Pre-Hospital Stroke Scale.
Mrs. Vega, can you smile for me? Okay, Mrs. Vega. Try to close your eyes. I want you to hold your hands out front. Okay. Mrs. Vega, I want you to repeat something for me. Can you say, "You can't teach an old dog new tricks"?
You can't teach dog.
The stroke test definitely showed key abnormal indicators, strong signs of a possible stroke. And Mr. Vega informed us that the symptoms had started 20 minutes before we arrived. I knew I had to make decisions quickly.
To help identify which hospital is most appropriate for the stroke patient, EMS should also perform a severity screen to indicate if there is a possible large vessel occlusion. As always, EMS should follow local stroke protocols.
What are her vitals?
Blood pressure is 190 over 110, heart rate's 110, respirations are at 14, her pulse ox is 95.
Her blood pressure was elevated, but her oxygen saturation was normal. Mr. Vega, we think your wife is having a stroke. We'll need you to come with us to County Medical. They're specially equipped to handle the situation. The sooner we get there, the better.
Good. Happened so fast. The EMS team had her checked out in 10 minutes. And they even let me ride in the back, keep her calm and answer any questions.
The third link in the stroke chain of survival is rapid EMS transport to a hospital that is equipped to deal with acute stroke. This is also the third D of the 8 Ds of stroke care, delivery of the patient by rapid EMS transport.
Rescue 21, go ahead.
We are en route with a possible stroke patient, a 45-year-old female with weakness on right side, facial droop on right side, and difficulty speaking.
While we were en route to the stroke center, I radioed ahead so that the stroke team could be fully prepared once we arrived.
Patient's blood pressure is 190 over 110. Her heart rate is 110, and her respiratory rate is 14 without difficulty breathing. Patient's blood glucose level and pulse oximetry readings are within normal limits. The patient's ECG shows sinus tachycardia without ectopy, and according to family members, the first onset of symptoms was approximately 23 minutes ago, 11 a.m., and we have an estimated time of arrival of 5 minutes.
Received, Rescue 21. We'll be ready. Let's activate our stroke team.